Thank you, Mr. Chair, and thank you, Mr. Little. If I can switch gears from COVID for just a moment and ask a question about reproductive health care. Last year, I carried a bill that repealed the ban on abortion coverage on our state health insurance exchange. That ban wasn't just bad for patients, it was just bad law. The ban had been shoved into an unrelated section of insurance law, singling out abortion as the only safe and legal medical procedure that could not be covered. It was all politics and not about patients. My question is whether you will safeguard Virginians from that kind of discriminatory policy. Do you believe Virginians have a right to end a pregnancy? And if so, will you ensure that Virginia does not discriminate against abortion patients, providers, or procedures in medical care?
Thank you.
And I'm going to interject there, Delegate Littel, because it sounds like the patron is asking a question as to whether you're going to enforce the policy passed through this legislative body. Am I correct, Delegate Hudson? That's the crux of the question.
Mr. Speaker, the crux of the question is not just about law, but also regulations that would fall under some discretion of a state agency.
And so for clarification, Mr. Littel, feel free to address the part as it relates to regulatory power, but we know any secretary, governor has to follow the law of the Commonwealth.
Correct,
Indeed.
correct. Well, I appreciate, one thing I think that we're going to be looking at is regulatory rules, making sure that they are in the right place. I do think that that is important. So, going through all the regulations that we have and figuring out whether they are in the right place or not. So we will be doing that. I obviously will be following the law. I'll look more closely into that.
Thank you, sir.
Okay. I thank Dr. Littel for appearing this. And I believe
Not
you're
a
a
doctor.
doctor, correct?
I feel like I'm a doctor at this point, but
yet.
I'm not.
Okay, Mr. Littel. Thank you. We're glad you're healthier this week and we're able to
Thank you.
arrange your schedule. And I encourage anyone on the committee to reach out to Mr. Littel with any other questions you might have. I'm sure he would be free to come at mutual convenience to meet with you privately and address any of those questions. But
Great.
thank you, Mr. Littel.
Thank
Great
you
to
very
have
much
you
for
this morning.
support.
Thank you for appearing. A couple little administrative matters. One just for the